So, what is pharmacology? Pharmacology simply means the study of drugs. In other words, it tells us everything about a drug, how it works, where it works, and what it does to our body. So, when we say pharmacology, we are not only studying the drug itself, but also how our body react to the drugs. This is very important because every drug that we take goes on a small journey inside our body. It enters, it works at a specific place, and then it leaves the body. So, pharmacology helps us understand this entire journey. Now, let us see where the word pharmacology actually comes from. The term pharmacology has a Greek origin in ancient Greek. Pharmakon means drug or medicine, logos means study or knowledge. So, when we combine these two words, pharmakon plus logos means pharmacology, which simply means the study of drugs. This shows us that even thousands of years ago, people were trying to understand medicines, and today we were continuing that knowledge through modern medicine. So, pharmacology is not just a modern subject, it is a bridge between ancient medical knowledge and today's advanced scientific understanding. Next, branches of pharmacology. There are two major branches you must always remember: pharmacodynamics and pharmacokinetics. So, pharmacodynamic means what the drug does to the body. When a drug enters your body, it does something produce an action or an effect. This action is studied under pharmacodynamics. For example, insulin lowers blood sugar. So here the drug insulin is doing an action. It is reducing the glucose level. That action is pharmacodynamics. So inside pharmacodynamics, a drug can work in different ways. There are receptor binding, which means the drug site on a receptor and produces an effect. Next, enzyme inhibition. Some drugs block enzymes to stop a reaction. Next, transporter inhibition, which means some drugs block channels or pumps. Next, the gene expression regulation. Some drugs can increase or decrease protein production. So, simply we can say pharmacodynamics explains how the drug produces its effect. Next, pharmacokinetics. Pharmacokinetic means what the body does to the drug. Once you take a drug, your body does four important things to it: absorption, distribution, metabolism, and excretion. Absorption means how the drug enters the bloodstream. Distribution means how the drug moves to different tissues. Metabolism means how the liver breaks down the drug. And excretion means how the drug leaves the body, mostly through the kidneys. So, a very simple way to remember this ADME. Drugs can enter the body through different pathways. These pathways are called route of administration. See, the route decides about how fast the drug acts, how much of the drug reaches blood, whether the drug is suitable for emergency or slow action, side effect, and convenience. This is the classification of route of drug administration. First one is enteral route, second one is parenteral route, and third one is local or systemic routes. Enteral routes are oral, sublingual, and buccal. Parenteral routes are intravenous, intramuscular, and intradermal. Local and systemic routes are topical, inhalational, nasal, rectal, and vaginal routes. First one is oral route. The oral route is the most common and most comfortable route of taking medicines. We use tablet, capsule, syrups or powders and swallow them with water. When you take a drug orally, it first goes to the stomach, then to the intestine, and from there it is absorbed into the bloodstream. So after swallowing the drug dissolves, it absorbed from the intestine, it goes to the liver, then it enters the bloodstream and shows its effect. So this is why oral drugs take more time to act. For example, tablets, syrups. Next, sublingual route. So sublingual means the drug is placed under the tongue. So because the area below the tongue has many blood vessels, so the drug enters the blood very fast. So the tablet dissolves under the tongue and the drug directly enters the bloodstream. It skips the liver and it starts the actions quickly. So when we need immediate action, the particular for heart related emergencies, this route is very useful for the patients. Very useful for the patients. For example, nitroglycerin. It is used to treat the chest pain. Next, parenteral routes. Parenteral means medicines given by injections bypassing the stomach. So this include IV. IV means into the vein, IM into the muscle, AC under the skin. So why do we use injections? To get fast action when the patient cannot swallow, when the drug is not absorbed orally. So IM. IM means it directly into a vein and it is the fastest route in the whole route of drug administration, and it is used in emergencies like shock, heart attack and dehydration. Then IM. IM means intramuscular. It given into muscles like deltoid or thigh. This action is moderate, not too fast and not too slow. It is used for vaccines and antibiotics. Next, subcutaneous. It given just under the skin and it gives slow, steady absorption, and it is used to treat diabetic, for example, insulin. Topical route. Topical route means applying the drug on the skin or on a local body surface. The medicine acts mainly on that area. It does not go deeply into the whole blood circulation like oral or injection. It gives a normal local effect. So topical medicines are applied on skin, eyes, ears and nose. These are also considered topical because we apply it on the local surface. The drug works at the exact spot, for example, applying ointment on a wound, because the medicine is not going all over the body. So, no pain, no injection, no swallowing problem, and it gives a fast relief in the applied area. Next, transdermal patches. This is different from topical. A transdermal patch is a sticker like patch placed on the skin. The drug slowly passes through the skin into the bloodstream. The patch releases the drug continuously, drug enters blood supply, and effect lasts many hours or even days. So it is long lasting effect, no need to take tablets multiple times, very useful for chronic problems. For example, nicotine patch for quitting smoking, fentanyl patch for pain. Next, vaginal route. Medicines like tablets, creams, gels, and rings are inserted into the vagina. So, why we use this route? To treat local infections, very effective for fungal infections, and used for contraception and hormone delivery. Examples: clotrimazole vaginal tablets for fungal infection, estrogen creams, and vaginal contraceptive rings. Next, rectal route. In this route, medicines are given through the rectum, usually as suppositories or enemas. So, in this route is useful when patient is vomiting, useful for children who cannot swallow, useful when fast fever reduction is needed, and useful in constipation. So, this drug is absorbed from rectal mucosa. Half of the drug skips liver metabolism and its action is moderate. For example, paracetamol suppositories, glycerin suppository for constipation. Next, inhalational route. In this route, the patient breathes in the medicine through the nose or mouth using inhalers, nebulizers. So the drug goes directly to lungs, very fast action, and it requires smaller dose and less side effects. So it is usually mainly for asthma, COPD, bronchitis. For example, salbutamol inhaler. This is the simple explanation about route of drug administration. Thank you for watching.